Good morning, Chiriquí. Good morning, Boquete. It's a beautiful day out. Well, actually, it's overcast, but it's not raining, so it's a beautiful day.
There's no firestorms.
There's no firestorms. You are listening to Talking with Your Doctor on Radio Chiriquí 103.3 FM live, coming at you every Saturday morning. I'm here with Al Stefanelli. Everybody knows Al.
Hello. Good morning.
Our engineer, Bolivar.
Buenos días.
Buenos dias. Good morning, Veronica.
Yes, Veronica.
Can't forget Veronica down in David.
That's right.
And good morning, Dr. Tour. How are you doing?
Morning, fine, thank you. Hi, everyone.
Good morning.
Good morning. We can hear you just fine over here. Are you hearing us okay?
Yes, that was pretty cool music that I heard just before that.
Were you bopping to it too? We were over here bopping to the music.
We were bouncing a little in our chairs.
So we're here with Dr. Tour. We're here with Al Stefanelli, and we're doing part two of our two-part series with Al Stefanelli on vaccines. But we're also going to mix it up a little bit and throw in some info on allergies.
Oh, yeah.
Pediatrics. If anybody's got any pediatrics or allergy questions, you can send it to my WhatsApp at 6507-4299. Send me a message or send me a message to my messenger. Yeah. And we'll throw those questions out there.
Throw them out there.
Yeah, don't be shy. We don't have to mention any names. If you don't want names, we don't have to mention names.
We'll make up names.
Well, yeah, we're good at that.
Yes, we are.
So,
También en el live de YouTube está la sección de comentarios.
Oh, right,
yes,
right.
Yes.
Okay, yeah, in the YouTube channel on
Radio Chiriquí Boquete.
Thank you. I was stuttering.
Yes.
Radio Chiriquí Boquete. You'll find our live broadcast of the show, and you can also put some questions on the live broadcast, and we will try our best to answer them.
And since this is a two-part show on the Boquete Now Talk Radio YouTube channel, when I get around to it, I will combine both shows in one video and post that.
Oh, nice.
So, yeah.
Nice. That's a lot of work.
Yeah, well, you know, you're worth it, Shannon.
Oh, well, thank you. Oh, now you got me blushing. So anyway, we've been having a lot of questions about what to do if you got the first vaccine.
Right, the first jab.
The first jab,
yeah.
The first jab of either AstraZeneca or
Pfizer.
Pfizer, thank
yeah.
you. Why am I blanking on these things?
I don't know.
I don't know either. And you go somewhere and they don't have the one you need available. For example, you get AstraZeneca here. They don't have it in the States. If you go to the States and it's within your time for your second jab, what do you do? Dr. Tour, do you know if you can get the any of them? Can you mix and match vaccines?
Well, the data's not in right now, but that's beginning to happen. For example, in Canada now, if you get the Pfizer and then the AstraZeneca becomes available and you can't get the Pfizer, the recommendation is that it actually might give you an enhanced immune response. There's certainly not a contraindication. And now some people are saying if you get two of the Pfizer or two of the Moderna here, it may be fine to be able to get the AstraZeneca, well, not here, but to get the Janssen product the next time if you can't get it. So,
okay, the Johnson and Johnson. If let's say I got the Pfizer here, but when I go back to the States, it's time to get the second dose, but I can't get it. And can I get the Johnson and Johnson?
If you were staying in the United States, yes. The alternative is if you're just going for a while and you miss the window. For example, the Moderna window would be 4 weeks, but you could go up to 8. They've looked at extending the window, and many countries are doing that now, trying to blanket the country with the first one, and then extending the limit. And they're looking at that. The thing is, not enough data to know. It appears that there's not any harm, and some of the very recent studies indicate it might actually enhance if you've got a and then a platform immunization as the third one, the second third. Now, the second one, I'm not sure that there's any data yet.
Right. I've heard of people getting a separate shot. I've heard of people, for example, They come in, they've got the AstraZeneca, and obviously there's going to be in the States for a while, 3 or 4 months, and you don't have it, so they went ahead and got the Johnson & Johnson, which I assume is fine. I don't think there's anything wrong with that, and you'll still be covered.
Exactly. It's just that we don't have large-scale phase 1, 2, or 3 studies yet. But, when you look at CDC data, they don't seem to indicate that it would be a contraindication if there were no other choice. I think what's looked at, too, more recently is the importance of getting a booster, getting a second shot, I should say, if it entails getting. And now, for example, Cuba will have 2 shots. And they have Soberana 2. Now,
that's a beer here.
They have it there?
No, Soberana is beer. We should point out here in Panama.
Yeah.
We should point out that that's the name of one of the vaccines in Cuba. I'm not sure where it's from. Is it a Cuban vaccine?
From Institute Finlay, which should be familiar to Panamanians. Finlay Institute is probably one of the premier vaccine manufacturers and research centers in the world. And Carlos Finlay, along with Walter Reed and George Gorgas, were the ones who discovered that the mosquito was the vector. Carlos Finlay was also an epidemiologist.
Right, I remember reading about that.
Well, then they have Finlay Labs and Institute of Finlay, and it's something like Gorgas Institute. So they've got 2 very active vaccines being manufactured, and I think Iran is going to be making a lot of the Cuban vaccine under the tutelage, you might say, of the Pasteur Institute in Iran. There is a branch there.
Oh, okay. That's interesting.
It is quite interesting.
You've been doing actually a lot of studying up on this.
We have to keep up, but the field is constantly changing because we have all kinds of variations. And, we've got the Delta that everyone's worried about, and Delta, the Super Delta, and so forth.
Right, the Delta Plus or whatever it is. It sounds like an airline thing.
It sounds like so I'm a member of Delta Plus.
Yeah. I don't want to be a member of that club.
No.
But we've heard that although the vaccine might not be completely effective against Delta and Delta Plus, it has a pretty good, what would you say?
Well,
it does pretty well against the Delta strain.
Yeah, it's not as moderately.
You won't get as sick, even if you do get it.
I believe generally mild symptoms and probably no need for hospitalization. So no need to worry.
Okay, yeah. A lot of people are like, well, I finally got my jab, and now there's a new strain out there, and we don't know if it'll be effective. Apparently, especially the Pfizer is.
Well, there's a lot of misunderstanding and misinformation about these new strains. A lot of people are under the impression it's a completely new disease, and the vaccines that they're getting aren't pertinent to that, and that's just not the case.
Right. The fact is that the protein spike, which is the one that kind of attaches to the cells in your body, doesn't change all that much. So your cells should still remember it and fight against it. I think I've got that correct.
Yes, you do. Yeah. So far, we're going to do okay, and they're constantly. We have hundreds of variants actually. And if you ever were interested, you can look at CDC, and they're all enumerated. Now we're getting into the genomics a little more in the United States. And there are hundreds of variants, most minor. There are variants of concern, and they're the ones that you want to look at. But so far, so good. I think the major message would be get vaccinated. We're having a huge difficulty here getting that recalcitrant group to be vaccinated.
Well, we have the same problem here. There are groups that couldn't wait to get theirs, and I was in that group that just could not wait to get mine. I would have traveled anywhere, gone anywhere to get it. And then there's the other groups that would rather watch and wait and see what happens. They want to see, Is somebody going to grow
Right.
another eye or another arm?
Yeah.
Or
Another arm would be handy though.
it would. It would.
See what I did there? Handy.
Yeah. Handy.
Ooh.
So we've heard that. Sorry.
You could modify pianos and trombones and so forth. I mean,
Well, it'd
music
be
would
very
change.
handy for construction too.
Yeah. Or if you have more than 2 children.
So,
But-
so, or more than 2 dogs, or even 1 dog. Sometimes you need 3 hands.
Right, but if you look at the history of vaccines, how many have really had long-term adverse side effects?
As
If
far as
you-
I know, I haven't heard of any really having any type of long-term adverse effect.
Yeah. I'm
There's some tragic things that will occur, Guillain-Barré and so forth, but usually that's early on. But I ask every single patient, without badgering anyone, we don't want to do that, have you gotten the vaccine? And either it's yes or no, and I'll say, well, why not? I'm going to wait. Most of them just say, I'm going to wait.
Yeah, that's a typical response, or just a flat out, it's an experimental vaccine. I'm not getting it.
Yeah, we
Oh,
talked
sure.
about that yesterday. We were going to expand on what is an experimental vaccine and what is not, and
We kind of dropped
ran
the ball.
out of time.
Yeah.
Well, we ran out of time
Yeah.
actually on that. It was like 3 minutes to the hour, and we were like, well, let's just do that tomorrow.
Yeah, so I mean, what I was, and since I don't know everything. What I was reading was that it's experimental vaccine is when it's actually still in studies, like the phased studies.
Right, well, we're in phase 4,
Right, which is basically it's the testing and the approval phase. It's approved by the FDA for emergency use, which means they believe it to be safe and effective enough to use it.
That's right. And now, that certainly the Pfizer in this country, and we're waiting for Moderna, because now the next phase is vaccinating kids, 12 and up. And,
Right.
And you've seen data on cardiomyopathies, generally in males, very, very rare in the age group of 12 to 29. Tiny, tiny percentage. Most get better.
Right. There's really not been any major effects. We have heard of deaths. We don't know if they're related to the vaccine or not, or if it was some underlying condition that was made worse or anything like that. But, out of the millions of doses given, there's been a very, very good safety profile for the Moderna, for the Pfizer, and even for the AstraZeneca.
Mm-hmm.
AstraZeneca, I was looking at data on AstraZeneca about the thrombocytic, the thrombosis with low platelets, and in 1,000,007 in the average, that look. So that's tiny.
That's a tiny percentage. Yeah.
Insignificant almost.
Yeah, you have a better chance of winning the lottery.
Yeah. That would be nice.
Much.
I wish I could. But the vaccines are very, very, very safe. Very few people have had side effects. We don't like to see anybody suffer any side effects from any
No,
vaccine, but
no. It does happen though.
it happens because everybody is different. Everybody's system is different. Everybody reacts differently, even to medications, not just
Sure.
vaccines.
Well, I think if you could compare the effects of COVID infection in those who have symptoms, much, much worse than side effects from the vaccine.
Right, and you normally don't get over side effects or symptoms from COVID in 1 to 3 days.
Right.
It can go on for months. The vaccine, I had symptoms for maybe 24 hours maximum.
Yeah, well, when we got our first AstraZeneca jab, my wife got sick. She was down for a couple of days or so. That first night, her fever spiked to like 103, and she had very, very bad flu symptoms. But The next day, she was demonstrably better, and by
Yeah.
the third day, and my reaction was like, I had some body aches for 4 or 5 hours.
Yeah.
I was fine at the end of the evening, but
Yeah.
that just speaks to the different reactions people have.
It's
to
your
the
immune
vaccines.
system. How
Yeah.
strong is your immune system? Obviously, Day has a very, very strong immune reaction, so
Yeah.
her immune system is pretty good.
Yeah.
Right. I think he pointed it out, Al, though. The virus itself is kind of capricious, isn't it? And I think the vaccine, too. Because we have a lot of people that say, oh, my, I'll get the first one, but I dread the second. And some people have no reaction to the second,
Right.
but they do to the first.
Right.
You just can't.
Yeah, I was
wouldn't let-
lucky when I had a reaction to both.
You got the bonus.
I
point.
got the bonus package. But
If you get a reaction, so what? You know what it is. Put up with it.
yeah,
I think
yeah.
You know,
I have a lot of people that get a hold of me. They send me a message. They're worried because maybe 4 or 5, not 4 or 5 days. Let's say about 72 hours afterwards, they're still feeling kind of tired. They're still getting a little bit of fever or just feeling the body aches, and they ask if they should go get tested. Well, we tell people, report your symptoms to the Ministry of Health, because they are the ones that control the side effects and the symptoms from the shot, and then just wait it out. Very few people need to go get a
Diagnosis,
COVID test,
yeah.
another COVID
Yeah.
test, because we know that those symptoms can last 3-4 days
Well,
after.
excuse me. The only I don't even want to use the word long term. The only extended issue I had, which went a couple of days after the jab, was the injection site was a little sore.
It's sore, yeah.
It was
sore muscle.
and that was it. But in contrast to that, my 74-year-old mother-in-law got COVID in a nursing home, and like I said yesterday, we're amazed that she survived.
Yeah.
She's got dementia and her health isn't very good, but she did survive. This is about 6-8 months ago, and this is a woman who had never smoked a cigarette a day in her life. Still to this day, almost 8 months later, it hacks like she's been a 3-pack a day smoker. She has trouble breathing. She wheezes, and this has been since she's recovered from COVID. It took her 3 weeks to get out of that danger zone.
Right.
So
It takes a while.
You
It takes a
compare
while.
that to a few days not feeling well.
Yeah.
I'll take the few days.
Exactly. I prefer to have the vaccine than to have COVID, but that's just me.
you like that. I had one this week. I had another that just couldn't get over her pneumonia post-COVID. And then you hear about brain fog. And I was listening to a neurologist talking about that, because sometimes he was saying if patients tell their friends they've got brain fog after the COVID infection, a lot of them are just dismissive about it. But he said it's a real thing, and you don't want that. These are people that just are having difficulty concentrating and remembering and so forth.
Right. And there's some people that come to me and they say, I still can't eat because food tastes terrible. I still can't taste anything. Or I can only taste, maybe salty, a little bit of salty, or just a little bit of flavor, but not anything. So everything tastes terrible, so I have no appetite. And we have no idea if they're going to ever get their sense of smell and taste back.
Right.
Right, but to put it in perspective, the vast majority of people do get over their COVID and
Sure.
do okay.
Right. Right. These are specific circumstances, but there are others that, they end up in the hospital and they just get out and they're on oxygen. They can walk, 10 feet, and they're just extremely tired. And it's just amazing the range of effects that this virus can give you.
And still, the best response is get the vaccine.
Yeah.
You said it.
Well, not response, that's prevention.
Prevention, yeah.
Besides washing hands and masking up and
Yeah, I think if you have to consistently be reminded to wash your hands every day, you have more problems than. Listen to your mother. Wash your hands.
Wash your hands. Cover your nose and mouth when you sneeze.
Yeah.
Well,
Well,
how
you
is
know-
the vaccine distribution distribution doing in Panama now? In the country?
The distribution, it's going. It's slow, but it's going.
The main problem with distribution here, and I know, Dr. Tor, you're well familiar with this, is not getting it distributed to the populated areas. It's getting it out into the interior of the country, the mountainous regions where you park and then you got to hike, 20 kilometers to get to a village. That's where it's slowing down. Is trying to get, they did Panama City. They did in what 6 weeks, I think.
Yeah, Panama City was really quick.
Same thing with Santiago, which is another main area. And here in Chiriquí, but now they're trying to get up to areas in Bocas. They're trying to get to the interior, to the indigenous communities.
San Blas,
and
Darien.
San Blas
they
is
were
a
doing,
nightmare.
but, yeah.
You got to go over the mountains on a 2-lane road. It's 25 kilometers, takes 3 hours, and that's just to get to the port of Carti.
Yeah.
Now you got 365 islands that have no power, no electricity, no plumbing or anything. And the sanitary conditions are not what they should
They're lacking. They're lacking.
And to try to get this distribution done, a lot of people that live in the States or live in Canada or whatever, and there's a road to everything. If you have an address,
except for Alaska. Could you imagine Alaska?
I know, right? But if you have an address in the States or in Canada, you'll get mail, right?
Yeah.
So it's not that way here, and in a lot of the developing nations. So logistically, distribution is very, very difficult.
And also just gaining the trust of the indigenous. They don't really trust the vaccines, or any vaccine really. So this one even less.
Yeah, absolutely.
But we are the AstraZeneca now is it's a rapid drive-through type of deal now. It's available in all the provinces, and it's available to people over 30 years of age and I think under 60.
Yeah.
I think those are the restrictions at the moment.
Well, that's great. And then the Pfizer is being distributed too.
Well, the Pfizer right now is for over 60, for teachers, for pregnant women, for nursing women, and medical and first responders.
Right.
Pretty soon they'll have it available, more widely available. I think they're planning on having 90% of the country vaccinated by September.
That's their goal, yeah.
Yeah. So that we have herd immunity. But we shall see. There's a lot of resistance out there still to the vaccine.
Yeah. Well, it kind of got away from us here. I just see that, or this, that they just locked down New South Wales again in Australia, and they're worried about, less than 100 cases. So Sydney is shut for the next 4 weeks.
Right.
So they really had
also, South Africa is having a lot of problems right now with their cases.
Well, I understand only 2% of Africans have been vaccinated so far. But I think there's a global effort now to get this vaccine out.
I think so. And the White House released something, I believe it was today or last night, that they're trying to up the vaccination rate due to the Delta virus and the outbreaks that are happening in the States right now as well. They're trying to really publicize it and get it done because of this it's not really a new strain. It's an older strain, but it's more contagious.
Yeah. Then they're also not reclassifying, but they're changing the nomenclature on these strains to try to avoid, this is the Indian variant, the UK variant. So
right.
they're giving the Greek, alpha,
Yeah.
they're giving them the Greek. So Delta Plus is basically just a more virulent strain of Delta.
Apparently. Or at least
that's
more
what they say.
contagious.
More exactly. Yeah, I think the beta. I'm trying to keep track of all of them. The B1 351. I think the gamma is the P1, which we used to say Brazil. I guess it's better just to identify them.
Yeah.
But anyway, we have to just push and do everything we can, and I think we're so fortunate to have availability of vaccine.
Yeah, especially in the U.S. I mean, right now it's open for anyone over the age of, I think, 12 to get it, right?
Not really sure what the age is. I know the last I heard was over 16, but they more than likely have modified that.
Yeah, I don't know.
Yeah. Pfizer now 12. But I'll ask parents when they come in with their children, they're going to wait, or no, I don't want it yet. And you can see their reluctance with their children, I guess.
Yeah, especially since they haven't really gotten the dose down for the kids. Is it going to be the same? Is it going to be the adult dose? Is it going to be a modified dose depending on the age of the child? We don't know yet.
Right.
But we do know that we need at least, not 80-90% of the population to be vaccinated to be able to get that herd immunity going, just like with any other vaccine.
Yeah. The herd immunity is it's another very misunderstood aspect of this.
Yeah.
People don't know why. Well, why do you have to have 80% or 70%, of the people vaccinated? And sometimes it's hard to explain that, to people who don't want to hear it. But I think the worst thing that you can do is let the virus itself accomplish the herd immunity rather than have the vaccine accomplish the herd immunity.
Right.
No, exactly. We had the infamous Dr. Atlas. That was his theory.
Yeah. That guy.
That one. Yeah, no. Are there any contraindications for children getting the vaccine besides the age group?
What I understand, because I asked that very question, what I understand is it's the same contraindications, which are almost, what there are only two contraindications.
Uh-huh.
One is for anyone. One is you've had an allergic reaction, that is within 4 hours of receiving any vaccine.
Uh-huh.
And the second, in the two-dose vaccines, if you've had an allergic reaction after the first one. Those are the only two. We have tons of people, because of what I do, immunodeficient people, autoimmune disease, diabetes, all kinds of things, but they're not contraindications. So they're really the only two. We have people who want to kind of fine-tune it. We had one the other day. Well, I'm allergic to polyethylene glycol, and we know that is a stabilizer in the 2-messenger.
Uh-huh.
And then polysor in the Johnson product. And there's really not a great test. It's being bounced around our literature. Could you just test for polyethylene glycol? But generally, those are the only two contraindications. And I haven't seen anything. I'm not sure, but I haven't seen anything that would have another contraindication for children.
Right.
So
I haven't noticed anything either. Besides the age group that they're permitting to get vaccinated right now, and as you said, allergies to the components of the vaccine.
Yeah, but really, we don't. The thing is, if you look back, that's the problem. Some of the vaccines have had polyethylene glycol, but we don't have a good handle on them. So they're just kind of blanket saying. But remember, that's just an allergic reaction. That would be hives, wheezing, throat. Not, I felt sick, I got a headache a few hours after my first one. That's not an allergic reaction.
Right, that's just a normal immune reaction.
So now what they're finding is people with immunodeficiencies may need a third dose.
Right, because there's finding that people that have some kind of treatment, such as with prednisone or, chemotherapy or something like that, their immune system is suppressed, so they're not going to react as well to the vaccine.
Primarily chemotherapy, if we have someone on a little bit of prednisone for their arthritis, I think they're looking at everything, but I don't think that would be as much to worry about. So they're just looking at levels of neutralizing antibodies after the second dose, because it's really those that are doing. Plus, you're building all these memory T lymphocytes that will keep it in our system. So, not to get any, but anyway, I think the message that I'd give is just get it as soon as you can. Get that vaccine.
If I'm taking an antibiotic, can I get the vaccine?
Yes, It's better if you're super sick. The thought is it's better to get over it first. Yeah, it wouldn't preclude you getting the vaccine, but you don't want competition, even though the bug is totally different.
Right. If I had like a simple sinusitis and face pressure and I was taking an antibiotic for that, it would be fine for me to get my vaccine, as long as I wasn't, already having fever and other symptoms.
Oh, yeah. If you're just being, or if you're on prophylactic antibiotics for recurrent urinary tract infections, something like that would not preclude it at all.
And another interesting aspect of the process, from what I understand, the process of developing a vaccine is testing it against how many different other medications, for interactions. So when you ask a question like that, if I'm on antibiotics, can I still get the vaccine? That's already been researched with so many different medications. So now if I ask you, you as my doctor, I say, okay, Dr. Shannon, I'm taking, metformin for my diabetes. Can I still get the vaccination? Or if I'm taking this, and then either from experience or a data sheet is this has all been taken into account.
It has. We get, as doctors and also medical personnel that administer vaccines, they get the list of contraindications or possible interactions. But really, as far as I know, there's no interaction with any type of medication and the vaccine.
No. We have a standard form, a CDC form, here that everyone gets. They have to fill it out before they get the vaccine. So it asks specific questions like, things like that. Are you on any other medications? Have you had any allergic reactions? But we get tons of people, I carry an EpiPen because if I get a bee sting, I need to use my epinephrine. That's not a contraindication.
I don't think we're that sophisticated here.
You can't get EpiPens here over the counter.
Well, no, I didn't mean EpiPen. I meant the form.
No, the form basically has, my memory being what it is. They ask you do you have hypertension, do you have diabetes, do you have cancer, and then there was another one on there, and then there was a huge area for other.
For other.
To where you would
write out what
what you have. It was a very short list.
Huh.
Right. No, you have a good memory, Al.
Well, I have hypertension, I have diabetes, I've had cancer, so it's just all on my list. We have the same list, mutual list.
That's exactly it. For all these yeses, and we just say, get it.
Yeah.
So,
I don't think that, no matter what you fill out on the list, I don't think that is going to stop them from giving the vaccine.
No, I know. I think, though, that's probably part of a research dump. We say, okay, in addition to having, the information of people who live here, well, now we have a good idea that out of the, 2 million people who we've vaccinated so far, we know that, 800,000 people have diabetes. So that may be a way for them to address other health issues here in the country.
Well, that's interesting. I never thought of that.
Do we know yet if a nursing mother has gotten her vaccine, if she passes that protection on to her baby?
Ooh, good question.
We know that it's not a contraindication. I get that question all the time.
Right. We know it's not a contraindication, but will she pass along her immunity to the baby?
No, I don't think so.
Okay.
Well, we couldn't count it. I'm sure that hasn't been, maybe someone's looking at it.
Maybe. It's still too soon.
Yeah, it's still too soon. Let me just check one thing. I'm sorry.
Okay, no problem. We'll just fill in here with a little chit-chat.
So, how are the kids?
Yeah, they're great. Yeah, I took them for a walk yesterday, yeah.
One of ours has been acting very strange.
Oh, yeah?
Very clingy.
Oh,
very clingy and playing with their ears, so we're going to get some ear mite
drops, yeah. Well, they had some really good antifungal, antibiotic, and anti-inflammatory ear spray.
Ooh.
I forgot what it's called, but I can get a picture of it and send it to you so you know which one it is.
Yeah, that would be cool.
It's good because it kind of foams in there.
Yeah.
So it's not liquid they're just going to shake out.
Right.
You put that foam in there and then kind of massage it in, and they hate it. But
Well, you know, what are you gonna do, right?
right. I mean,
This has been the veterinary portion of talking with your doctor.
Sorry, I just walked back.
so did you?
I don't-
Are you back with us again?
Yeah, last thing we were talking about was babies, and then I hear about spraying things in their ears.
We're talking about our four-legged friends.
Our four-legged, yeah.
four-legged babies.
Fur babies.
Fur
They
babies.
are. No, here.
Yeah. Well, and then from the stand of side effects, of course, a lot of people don't fill it out, but there's the VAERS system, VAERS, Vaccine Adverse Event Reporting.
Right.
That goes-
Right.
But you know, most people don't use it. But it'll help, I think. We'll
Yeah,
see,
no, there's a lot of people that are anti-vaccine that will look up the VAERS reporting and say that look at all this, and this is another good reason to not get the vaccine.
We just don't want the pool of unvaccinated people to allow more and more replication. They're just looking for trouble. But that pool will start getting smaller, perhaps. I shouldn't say
Yeah,
that.
I think
But-
so. I think so. I think a lot of the noisiest opponents are also the ones that say, well, if I want to travel, I guess I'm going to have to do it. So,
Yeah.
you know, they know they're going to do it anyways, eventually. They just like to make some noise out there and be influencers, I guess.
Well, you know, it's you have a certain group of people that, you know, they're compelled to speak publicly on things that are important to them, and you know, no one is doubting that the points of view held by anti-vaxxers are important to them.
Right.
The issue is the dissemination of
Misinformation. Yeah.
Yeah.
And it's fine to be against, you know, you've got your own, it's your body, it's your life, it's your decision. But the problem is when false information gets distributed or just misrepresented information.
Misrepresented information.
Because on the VAERS system, they report everything from my eye itched or my little eyelash fell off right after the vaccine, all the way up
that's
to...
the problem with statistics.
Yeah.
Is you know, if you have a body of information, you can formulate whatever statistical analysis you want. If you don't have, you know, the proper vetting of the information, or if you don't have the proper correlation of the information. So yeah, you know, you can take that and say, well, if you get vaccinated, you're going to go blind based on, you know, my eye itches.
Yeah.
You know, so it's really important to have your information sorted and vetted before you put out any statistics. You know what they say, you know, 86.5% of statistics are made up on the spot.
Oh, yeah? Like that one right there. Oops, I just pulled out the headphones.
Yeah. I think Lincoln said that in his address. It's on someone recorded it on their iPhone.
Yeah, probably. But it's true. There's a lot of misinformation. There's a lot of scary information that goes around that, you know, especially on social media. A friend of a friend, you know, this is secondhand knowledge, but it's my best friend's family member, you know, got the first shot and had a terrible reaction. His platelet count went down, and then he got the second shot and he died.
Yeah.
Yeah,
they failed to mention, you know, he also had Hodgkin's lymphoma.
Yeah.
You know, and that's the thing. A lot of the I'd say a vast majority, or even, dare I say, most of the misinformation that is being disseminated out there is not being done with malicious intent.
No.
It's not being done with an agenda to misinform. It's just, that's the nature of social media.
Yeah.
And things get shared without being checked. And unfortunately, that leads to a lot of these very persistent conspiracy theories.
Yeah.
And the only thing effect that has is less people are getting vaccinated, and it takes longer to reach herd immunity.
I can't believe we're already like 10 minutes left in the show or so.
I know, right?
Yeah, it's been going fast. I know you wanted to talk some about allergies, which are like wreaking havoc on Panama right now.
God, yeah.
How are the allergies? How is the allergy season going in Florida?
Now it's dying down. I mean, we finished trees. Grass is pollinating. Palms are pollinating. But what it is rainy season. So mold is high.
Okay.
And when pollen, down to the ground. So it's actually a little low right now.
Oh, okay, good.
Here.
Good.
That's good to know.
Not here.
Not here.
No.
No.
Really, what's pollinating there right now?
Green stuff.
The grass, definitely. Many
Yeah.
flowers. I haven't seen too many trees pollinating, so because I haven't found the green dust on the car.
Yeah.
But the grass definitely, and mold definitely, because we've had really wet weather recently.
Yeah. So, it's funny. The people were saying during the dry season, this is the wettest dry season, because it rained a lot through the dry season.
Right.
And now we're getting monsoons coming through here. It's
Right.
where you got to pull the car over.
Yeah,
And just sit there and wait it out.
really heavy rains.
A safe way off the road, by the way. Don't pull off on the shoulder, people, because
Yeah,
that's
pull
what's
into a
wrong.
parking lot, do something, because
Or one of those
you can't.
retornos.
Yeah, the retornos, because you can't see the cars. You can't see 2 feet in front of you.
Yeah.
And most people don't have their blinkers on or anything like that, and all of a sudden you're right up
Yeah.
on them and you have to make a sudden move. That's not good in the rain.
But there's, with the rains here, and I'm not familiar, and I lived in Florida for a little while, but not long enough really to remember. But having lived in Georgia, Alabama, North Carolina, during the rain here, there's not much in the way of ground saturation. It's a
Right.
lot of runoff,
Right.
which I think is probably why it isn't as bad as it could be.
Yeah.
Because a lot of the rain ends up going into the gullies and down into the rivers and creeks and
It
out to
runs
the-
downhill, yeah.
it
We're
runs
up here, it
downhill.
runs-
So I think it could be a lot worse, but
Yeah.
it is pretty bad this season.
Yeah,
we have
well,
a question from Mom.
Hi, Mom.
Hi, Mom. She wants to know if
You
masks.
washed your hands. She wants to know if you washed your hands.
I washed my hands, Mom.
Okay.
She wants to know if wearing a mask is helping with allergy symptoms.
Oh, good.
Yes, it is. That's a very good question. I don't. A lot of people are telling me that anyway. And pollen is 30 to 60 microns. Mold is 3 to 7 microns. So a proper mask is cutting down on allergy.
And the symptoms
course
too?
Beg pardon?
And the allergy symptoms too, I guess, if it's cutting down on the.
Allergy in general, but not on the symptoms. The problem is, generally, and certainly here in Florida, the majority of people are not wearing masks.
Right.
But when you have the allergy symptoms and you have to wear a mask, it's pretty miserable.
It is.
Very hard to blow.
What is the etiquette when you have to sneeze and you have a mask on and you're in public?
You run the other way. No, I think. Say excuse me and change your mask.
If you really want a lot of personal space in public, cough or sneeze on the grocery store line.
Yeah, that'll clear the store. Or a really nasty phlegmy cough.
Yeah.
That'll get rid of people. Mom says hi to everyone, so I guess that includes you too, Dad.
Hi, Mom.
It's funny because you're not that far away from each other.
I still wear a mask. If I go to the grocery store and so forth, I'll wear a mask.
So when I go to the States, am I going to get heckled if I wear my mask around?
No, because I'm constantly wearing my mask in public. Not at all.
Okay. Yeah, I don't think that I feel quite comfortable taking off my mask.
No,
I've
I
been
wouldn't.
wearing it for a year and a half now, and I just
wouldn't.
don't feel comfortable taking it off in public spaces,
Yeah.
especially in closed public spaces.
I think you're right. I think we might be protecting some people because even if we're vaccinated, we could shed the virus. We could be receptacles without being knowing that we have it.
Right. Shedding the virus, we're not talking about vaccine shedding.
Yes,
Shedding the
yes,
virus,
you
we're
need to-
talking about being infected with the virus and
Yeah.
being able to transmit it.
There's a whole conspiracy theory out there about shedding.
Yeah.
So, but to prove the mask theory is right about droplets and airborne spread, our flu season was next to nothing this year.
Yeah, so is ours. We haven't.
Yep.
even diarrhea season, gastroenteritis season, I should say.
Diarrhea season.
Diarrhea season. Well, here at Boquete, it's diarrhea season, so.
That is
But-
funny. I'm gonna
They
make
came out
I'm gonna make a
wrong.
T-shirt or something like that.
Diarrhea season. Oh boy.
I wear my mask on my face, don't you?
There are days, Doc.
Yeah. Wait a second here.
We should do that on our next show,
What's that?
the diarrhea season show.
Diarrhea season show. That sounds good. When I come back, I'll
We'll have to
invite you
work
on.
on that.
We'll
Yeah,
talk
talk
about
about
diarrhea
diarrhea.
season. Yeah,
The whole show
a whole show of it. Would you like to be a part of it?
from a distance.
How was dengue? I guess you don't get dengue up in the uplands there.
We do actually. We on the Costa Rican border. There's dengue
Up here in the mountains, yeah.
Up here in the mountains. Yeah.
That's not normal
Oh.
though.
No, but
Yeah.
and there's been an uptick in cases too,
Yeah.
from what I understand.
Yeah, about 6-8 months ago, Mensa had put out a notice. The Ministry of Health here put out a notice about dengue and to warn people to, hey, this is still a thing here.
Yeah,
be
it's
careful.
one of
yeah.
these. Yeah, because people are convinced there's been no other illnesses. There's been
Right.
dengue. There's been heart attacks.
Yeah.
There's been cancers. There's been, a lot
Diarrhea.
of diarrhea season. Parasites.
Oh, sure.
Yeah.
Yeah, otherwise known as diarrhea season.
Well,
Usually
on the
happens
public
during the rainy season.
Good old ivermectin.
Well, you're stressing the importance here to people to do their regular cardiovascular exams. See your gynecologist. Don't let everything go. Don't
Yeah.
be afraid to go to the.
Yeah, I've had a lot of those people that say I really shouldn't have waited this long. I've had this lump, or I
Yeah.
really shouldn't have waited this long.
Yeah.
I've had palpitations every night for
2 weeks or whatever. Yeah.
6 months.
6 months.
Yeah.
No. You don't want to forego your regular regimen of
No.
health care.
Yeah, no. Going to see your doctor is okay. We take all the precautions.
Yes.
Speaking of going to see your doctor, you won't be able to see me for about the next 3 weeks in the clinic here. I'm going on vacation, and we've just about out of time, so
Got about a minute left.
got about a minute left. And I just want everybody to know I'm not sick. I didn't get COVID. I'm actually going on vacation, a well-deserved break, I believe.
Yes.
But I will be back 18 July to start seeing patients again. So
Nice.
nice, yeah. So, but if you need to get seen by a doctor, there is someone that's covering my shift at the clinic from 4 to 6 p.m. Don't hesitate to go see him or her. I don't know who it is.
Yeah. Whoever's there.
Whatever it is, yeah. I'd like to thank Al,
You're welcome.
Dr. Tour. I'd also like to thank Bolivar for being our great
And your mom.
engineer, and Mom. Thanks for writing in, Mom. You were the only one. And I hope everybody has a great weekend. And there will be no program until after the 18th, of course. And have a great weekend, and we'll see you when I get back. This has been Talking with Your Doctor with Dr. Shannon.
Thanks, Shannon. Is Al going to have his program?
I will. My program will be here every Friday from 10 to 11 a.m. on Radio Cherokee. 103.3 FM.
Live.
5-3.
103.3.
Punto tres.
Cut.